Hi guys, welcome back to the channel. Today we're going to be looking at inoculation injury procedures. In dentistry, it is necessary to work with sharp instruments including needles, sutures, scalpels, and hand instruments. The practice minimizes the risk of sharp injuries by risk assessment, control measures and training, having policies and procedures in place and consulting with the dental team. The definition of an inoculation injury is a blood or bodily fluid contamination incident, which occurs when one person is exposed to blood or bodily fluid of another person. This includes penetrating injuries from a sharp object, contamination with blood or bodily fluid, contamination of a broken skin surface, such as a cut or a graze, splashes into the mouth or the eyes. The World Health Organization, the healthcare workers are at increased risk of infection with blood-borne pathogens because of the occupational exposure to blood and other bodily fluids. Most exposures among healthcare professionals are caused by percutaneous injuries with sharp objects contaminated with blood or bodily fluids. These sharps include needles, scalpels, lancets, and broken glass. The pathogen most commonly transmitted to healthcare workers in occupational settings is hepatitis B, C, and the human immunodeficiency virus, HIV. The risk of infection from sharp injuries, as stated by the Health Protection Agency, state the risk of infection following a percutaneous injury, especially deep penetrating injuries involving a hollow bore needle or a device visibly contaminated with blood, has been estimated at 1 in 3 for hepatitis B, 1 in 30 for hepatitis C, and 1 in 300 for HIV. As part of your OSCE examination, it's very important that you are able to demonstrate how you can prevent inoculation injuries and also what steps to take if an inoculation injury has taken place. So key steps of preparation to manage inoculation injuries: it's important that you are fully immunized against hepatitis B and that your antibody titers are within the required range, that you utilize and use all appropriate PPE, that you review the regulations and other guidance in SHARP and are aware of the infection prevention and control policies, adapt to the inoculation injury poster to meet your requirements and complete the contact and post-exposure prophylaxis details on the poster, which should be usually available in every dental practice setting. In the unfortunate circumstances of sustaining an inoculation injury, you must be able to demonstrate and explain the process involved post-injury. So in case of an inoculation injury, act promptly as follows. Stop what you are doing. Remove any gloves. Encourage bleeding and allow the wound to bleed. Do not scrub. Rinse the affected area with ordinary tap water. Dry by dabbing with paper towel. Cover with a waterproof plaster. If you've had a splash to the eye, get a colleague to help you rinse the eye for 1 minute. Your practice may have an eye bath to irrigate and clean the eye with. If you wear contact lenses, remove the contact lenses from the affected eye before irrigation. Advise the patient about the incident. Inform the practice manager or the head nurse immediately. Ask the patient to complete a blood-borne virus risk assessment and a patient consent form. When the forms have been completed, contact occupational health. If not available, contact your nearest A&E for advice. Complete an accident book entry or fill out the accident treatment and investigation record. The decontamination lead or the practice manager will usually contact the local health protection agency or occupational health or the local A&E department for further advice. If necessary, question the patient, who should be kept in immediate contact until the occupational health expert has been consulted. Questions include a previous diagnosis of infection with HIV, hepatitis B or C, and having a high risk of HIV infection. Ensure that post-exposure prophylaxis for HIV is started within the hour if necessary, plus health surveillance or other follow-up actions as required. Notify the health and safety executive if there have been HIV or other reportable exposure. Investigate the circumstances that led to this injury, take actions, and arrange for training to minimize the risk of recurrence. Well, thank you very much for listening. I hope you never get an inoculation injury during your practice as a dental professional. But if you do, you need to really be aware of the procedures that you should follow and what appropriate actions that you must take. In our practice, we use a safe method of removing sharps from used needles, and therefore it really minimizes the risk of any inoculation injury. We also adapt a policy where the nurses are not allowed to deal with any sharp instruments, and the dental practitioner is responsible to remove this. Well, thank you very much for listening. I hope you benefited. Please kindly like and subscribe to the channel, and we'll be bringing further tutorials for you in the future. Thank you very much indeed.